The learning objectives for Sharpening Universal Curettes. Articulate and draw the shape of a universal curette in cross-section. Demonstrate how to sharpen an instrument to maintain its original design by using TheCube's approach. Identify an improperly sharpened instrument. Demonstrate and be competent at correcting an improperly sharpened instrument. Articulate why it's important to use a sharp instrument. Articulate the cause and effect of using dull and improperly sharpened instruments. And directly apply the principles learned in this module to real-life work experiences. The required equipment you will need is a universal curette, sharpening stone, sharpening test stick, your loops, good lighting such as an LED light on your loops or the operatory light, gloves, lab coat, 2x2 gauze, and the TheCube 110 device. Before we get started with the actual process of sharpening, it is very important to know the original design of the instrument. If you cannot visualize or understand the original design, it cannot be sharpened correctly, and you won't be able to recognize that it hasn't been. How can you tell if the instrument is shaped as designed? Well, let's look at a new, unused instrument and a poorly sharpened instrument. In this example, the poorly sharpened instrument is pointed and no longer looks like the new instrument. We will be demonstrating how to sharpen the instrument while maintaining its original shape and design. As a consequence to letting the instrument deviate from its original design through poor maintenance, the hygienist will compensate in order to adapt an instrument, which can lead to potential injury. This hygienist is using a poorly sharpened and poorly contoured instrument. She has to alter her wrist out of the neutral position in order to get the instrument to bite the tooth surface. And she keeps trying to move the instrument in different directions, attempting to get the instrument to adapt. In review, let's look at the design of a universal curette. Identify the face, the cutting edges, the lateral surfaces, the toe, and the terminal shank. Universal curettes have two parallel cutting edges, and the cutting edge is formed where the face of the instrument meets the lateral surface. The face of the universal curette is curved from the terminal shank to the toe and is on the same plane with parallel cutting edges. Looking at the universal curette in cross-section, it looks somewhat like a half oval. Knowing the cross-section shape is important to help you better understand the sharpening stone angle and what happens to the shape of the instrument if the angle is off. How the stone angles influence the instrument shape. Let's take a few moments to look at the instrument shape when the angle of the stone is off when sharpening. But first, visualize what the result will be on the instrument in cross-section when holding the angle of the stone at the correct 110 degrees. If the stone angle is greater than 110 degrees, can you visualize what the instrument shape will be? The back gets thinner while the face stays the same, causing thinning of the instrument from the face to the back, and the back will get sharp and require recontouring. Eventually, the strength and integrity of the instrument can fail. If the stone angle is closed or closer to 90 degrees, visualize what the instrument shape will be then. Clinically, the instrument will be sharp but will not stay sharp for long, and it will require your hand to compensate in order to get the cutting edge to bite the tooth surface. You will find yourself attempting to close the blade on the tooth over and over again to get the cutting edge to bite the surface. When the instrument is sharpened correctly at 110 degrees, the functionality of the instrument is maintained and the instrument will last longer. And it will not take as long to sharpen and keep it sharp. Looking at our previous examples, the white areas on the screen depict the amount of metal needed to be removed during recontouring in order to get the instrument back to its original shape. Now let's look at what happens to the lateral surface when you are sharpening. If the stone angle is not maintained at the 110 degree angle while sharpening, bevels will be created on the lateral surfaces, or another way to look at it is facets similar to the way a diamond is cut. In this example, the stone angle is not being maintained but varies causing multiple bevels being created on the lateral surface. Bevels can also be formed by not holding the face parallel to the floor and instead shifting it in and out of parallel during the sharpening process. Bevels have been created on the lateral surface of this instrument because the 110-degree angle was not maintained while sharpening from the shank to the toe. An instrument with bevels like this can cause the hygienist to alter their hand position in order to get the cutting edge to bite the surface. This can cause strain and potentially lead to injury. When sharpened incorrectly, notice how much metal will need to be taken off in order to recontour the instrument back to its original design. Again, this takes much longer than proactively maintaining the original shape. Why do we need to sharpen? Using sharp instruments is the primary way to prevent hand injury to the hygienist. A dull instrument causes the following problems. This hygienist has to work an area over and over again because of a dull, rounded cutting edge, ultimately causing burnished calculus and for the procedure to take too long. The hygienist is having to press harder and harder in an attempt to get the calculus off, causing fatigue and strain. Look at how much her thumb is pushing on the instrument. As a consequence, the patient experiences a heavy-handed hygienist and discomfort or pain. And the instrument can slip, potentially causing injury to the patient or the hygienist. Using sharp instruments is the primary way to prevent hand injury. Sharp instruments prevent the hygienist from having to push too hard to remove the calculus, decreasing hand fatigue, thumb, and index finger injury. When the hygienist is using a properly sharpened instrument, it takes very little effort to scale. Using sharp instruments allows for accurate scaling techniques. Large and small sandpaper deposits are not left behind when using sharp instruments and an accurate technique. Sharp instruments gives the hygienist increased tactile sense to feel the tooth surface for fine and large deposits. When you can feel the surface better, you can remove the deposits with accuracy. With a sharp instrument, you are less likely to burnish the calculus. The instrument on the left is sharp, resulting in a clean surface. The instrument on the right is dull, causing burnishing of the calculus. A dull instrument has rounded cutting edges, requiring the hygienist to have to close the blade beyond the normal working stroke angle of 70 degrees in the attempt to get the cutting edge to bite the tooth surface. This typically causes burnishing of the calculus. Using a sharp instrument decreases the time needed to complete a patient. The sharper the instrument, the more the hygienist can feel the deposits while scaling, remove them, and then decreasing the need to have to explore each tooth surface. So, let's remember, a lighter working stroke leads to healthier hands. A sharp instrument decreases the working time needed, and a sharp instrument leads to complete debridement, giving the patient better care. Why do we need to sharpen? Using sharp instruments is the primary way to prevent hand injury to the hygienist. A dull instrument causes the following problems. This hygienist has to work an area over and over again because of a dull, rounded cutting edge, ultimately causing burnished calculus and for the procedure to take too long. The hygienist is having to press harder and harder in an attempt to get the calculus off, causing fatigue and strain. Look at how much her thumb is pushing on the instrument. As a consequence, the patient experiences a heavy-handed hygienist and discomfort or pain. And the instrument can slip, potentially causing injury to the patient or the hygienist. Using sharp instruments is the primary way to prevent hand injury. Sharp instruments prevent the hygienist from having to push too hard to remove the calculus, decreasing hand fatigue, thumb, and index finger injury. When the hygienist is using a properly sharpened instrument, it takes very little effort to scale. Using sharp instruments allows for accurate scaling techniques. Large and small sandpaper deposits are not left behind when using sharp instruments and an accurate technique. Sharp instruments gives the hygienist increased tactile sense to feel the tooth surface for fine and large deposits. When you can feel the surface better, you can remove the deposits with accuracy. With a sharp instrument, you are less likely to burnish the calculus. The instrument on the left is sharp, resulting in a clean surface. The instrument on the right is dull, causing burnishing of the calculus. A dull instrument has rounded cutting edges, requiring the hygienist to have to close the blade beyond the normal working stroke angle of 70 degrees in the attempt to get the cutting edge to bite the tooth surface. This typically causes burnishing of the calculus. Using a sharp instrument decreases the time needed to complete a patient. The sharper the instrument, the more the hygienist can feel the deposits while scaling, remove them, and then decreasing the need to have to explore each tooth surface. So, let's remember, a lighter working stroke leads to healthier hands. A sharp instrument decreases the working time needed, and a sharp instrument leads to complete debridement, giving the patient better care. Items you will need to sharpen your instruments. There are a variety of sharpening stones for various applications. Here is a sampling of some that are available on the market. You should familiarize yourself with the proper care and sterilizing recommendations for each particular stone you like to use. We will be using a man-made ceramic stone. You will need a test stick. You can purchase one, or you can use the disposable, clear, hard plastic air water syringe tip when at chairside. We will be using the 4R4L Universal Curette for our demonstrations. The technique we are teaching is used for all universal instruments. Please take note, this does not include sickle scalers. There's a separate module for sharpening sickle scalers. In order to sharpen well and correctly, you will need good lighting and magnification. You can use your loops with an LED light or your operatory light. Wear clean gloves, a lab coat, and have 2x2 gauze available, and the TheCube 110 sharpening device. Preparing to sharpen. First, you must familiarize yourself with the instrument design. You need to know the original design of the instrument before sharpening. If you don't know the original design, you cannot be sure you will maintain the integrity of the instrument as you sharpen. If you are unsure, always have a new instrument to compare your instrument to, as shown in this slide. We will be teaching you to sharpen the lateral surfaces of the instrument to get the cutting edge sharp. This will narrow the face of the blade, causing the instrument to become thinner, allowing for access into tight areas. Let's get started with the sharpening technique. When sharpening the lateral surface of the instrument, the angle of the stone to the face of the instrument is 110 degrees. Often, hygienists develop bad habits and don't realize they have come off of the 110-degree angle. In an effort to resolve this issue, TheCube has created the 110, a device for students and practicing hygienists to develop the ability to maintain the proper 110-degree angle at all times. The 110 device sets your 110-degree angle for you. The lights will indicate if you are at 110 degrees or if you're not. They will turn off when you're not at the 110 degrees. Therefore, your goal is to keep the lights on while sharpening. We recommend holding the instrument in your non-dominant hand with the toe of the instrument facing towards your body. Look at how the hygienist is holding the instrument and where each finger is placed for a good grasp and a neutral wrist position. When the instrument is not held correctly or firmly enough, the instrument can shift, potentially causing bevels to form on the lateral surfaces. In order to prevent this, stabilize the instrument in your hand firmly enough so that the instrument will not shift due to the pressure of sharpening. Anchor your elbows against your body for stability. If seated, we do not recommend stabilizing your instrument on a countertop because it makes your wrist come out of the neutral position. Be sure to keep your wrists as neutral as possible to prevent strain or wrist injury. Shown here is a neutral position for both wrists. You can stand to stabilize your instrument on the countertop. This way you will not have your wrists out of the neutral position, although you will be bending over. Just use the position that supports you the best. Shown here is a wrist out of the neutral position. You can hold the stone in two ways. One is with the fingers on the side of the stone, or two from top to bottom. Start with the terminal shank of the instrument perpendicular to the floor. At all times during the sharpening process, keep the face of the instrument parallel to the floor. As you move the stone towards the toe of the instrument, tilt the instrument to maintain the face being parallel to the floor. The hygienist is tilting the instrument ever so slightly to keep the face of the instrument parallel to the floor as she sharpens the cutting edge in increments of 2 to 3 millimeters. Starting at the shank of the instrument, align the stone on the lateral surface at 110 degrees. You want to keep the 110 lights on, indicating you are at 110 degrees. You only want to sharpen 2 to 3 millimeters of the blade at one time. This requires you to use only 2 to 3 millimeters of the stone to be adapted to the instrument in order to sharpen only 2 to 3 millimeters of the cutting edge at one time. Therefore, a gap occurs between the stone and cutting edge where you are not sharpening. The arrow is pointing at the gap where the stone is not against the cutting edge. Do not place the stone along the entire length of the blade. This will cause the instrument to become pointed. Begin to sharpen the first 2 to 3 millimeters of the blade at the terminal shank end of the instrument. Move the stone up and down in short, controlled strokes. Be sure your elbows are firm against your side to stabilize both hands. The 110 will not work well when using long sharpening strokes, therefore be sure to use short, controlled strokes. Watch the 110 lights to be sure you are staying at 110 degrees. Eventually, you will be able to see the 110 lights out of your peripheral vision. Sharpen this section of the blade until you see a black dust appear on the face of the instrument. Do not move onto the next 2 to 3 millimeters until you see the dust. Dust is an indication of eliminating bevels and dull, rounded cutting edges. Once dust appears, then move to the next 2 to 3 millimeters of the blade to sharpen. Sharpen this section until black dust appears. Again, do not move to the next section until the dust appears. Sharpening until dust appears assures your blade is properly sharpened and all the bevels and rounded, dull cutting edges have been removed. When moving the stone towards the toe, ensure the 110 degree angle is maintained along the entire cutting edge. Do not start to turn the stone inward as you approach around the toe. This will also cause the instrument to become pointed. Therefore, you want to maintain a straight path along the entire length of the blade from shank to toe. See how the hygienist does not turn the stone inward when approaching the toe? The toe does not always require sharpening. There are two ways the toe can become pointed. One is when too much of the stone is applied to the lateral surface, rather than sharpening 2 to 3 millimeters at one time. Or two, if you turn the stone inward as you approach the toe. The toe should be sharpened separately when it needs reshaping. This will be addressed in the TheCube module on sharpening the toe. The instrument on the left needs a small amount of the toe to be reshaped and recontoured back to its original design, where the instrument on the right really needs to be discarded. The pointed end can gouge the root surface. The 110 helps to maintain the stone angle to keep the original shape of the instrument. When using the 110, you should expect to see a surgically sharp cutting edge. As an example, the instrument on the left is dull and has many bevels. The one on the right is the same instrument sharpened using the 110. Testing for sharpness. Now let's look at testing your instrument for proper sharpness. There are two things to look for when assessing the lateral surfaces. 1, a dull cutting edge, and 2, bevels being formed on the lateral surfaces. Using your loops and good lighting, let's first look for shiny silver areas on the cutting edge. These areas are still dull. Dull areas reflect light. Sharp areas do not reflect light and will appear black. The sharpened instrument on the left shows how the cutting edge is not reflecting light back and appears black along most of the cutting edge from the shank to the toe, where the dull instrument on the right shows how the cutting edge is reflecting the light. Now let's look at the lateral surface for bevels. If you see several shiny areas reflecting the light in different planes, then you are causing bevels to form. This is caused from moving the stone in and out of the 110 degrees while sharpening the lateral surface from shank to toe. When sharpened correctly, the lateral surface should look like a machine cut the side in one cutting motion, with no interruptions. As you can see, there are no shiny reflective dull areas along the cutting edge, and the lateral surface does not have bevels reflecting light. To test for sharpness, you can use a sharpening test stick or a plastic air-water syringe tip. We suggest you don't use a suction tip. It's too soft and does not replicate the tooth surface well enough. Often we are taught to test the sharpness of the instrument by getting it to bite the stick. When you press hard enough, any instrument will bite the stick. The pressure required to bite the stick is the same pressure you will have to apply to the tooth. This is important to understand, so let me say that again. The pressure required to bite the stick is the same pressure you will need to apply to the tooth. Therefore, the less pressure you need to apply to the stick means less pressure you need to apply to the tooth to get it to bite. We recommend you lightly place the instrument against the test stick at a working stroke angle to shave the stick with the cutting edge. When at chairside, you can also check for sharpness by using a hard plastic air-water syringe tip. Check the entire cutting edge. This instrument is shaving the test stick when checking the cutting edge closest to the shank and in the middle of the blade, but is slipping off of the test stick at the toe end of the instrument, indicating the toe end of the instrument is dull. Don't make the mistake of thinking you only have to sharpen the dull section. This will over time alter the original shape of the instrument. You must sharpen the entire lateral surface in order to maintain the original design. You should see shavings come off of the stick with no pressure being applied. Again, this means you need very little lateral pressure against the tooth to work effectively. If the instrument does not shave the test stick using very little pressure, the instrument is not properly sharpened. Here, the instrument is not shaving the test stick, indicating the need for this instrument to be sharpened more. When to sharpen. Now, let's look at when to sharpen. So, when exactly do we need to sharpen? We've all been told at the first sign of dullness. What does the first sign of dullness even mean? Let's take a look at it from the clinical standpoint. In this video, the hygienist is starting to press harder, using her thumb to get more lateral pressure, potentially leading to hand injury. She's also attempting to get the instrument to bite the tooth surface by closing the blade. If you find yourself pressing harder or having to close the blade further and further, these are the first clues to stop and sharpen. If you have to close the blade more than one time and press harder, you're getting to the point of needing to recontour the instrument, which will take longer than the 3 to 4 strokes per section of the blade to bring the instrument back to sharpness. Don't cheat yourself by saying, "I don't have enough time to sharpen." This is the very mindset that will keep you from providing the best care to your patients and lead to potential personal injury because you are working too hard with dull instruments. When sharp, the instrument can give you tactile feedback of the root surface to the degree you can be using such a light stroke, like an exploratory stroke, and be scaling the root surface. Very little pressure is required for the instrument to be removing calculus and root roughness. Can you see how the hygienist now is using a lighter stroke, not pressing so hard with her thumb? Techniques for removing moderate to heavy and tenacious calculus will be taught in TheCube's training course on calculus removal. A useful way to assess your sharpening technique is to always have a new instrument to compare it to. This will allow you to begin to see and identify what the instrument should always look like. The instrument should always keep its original shape, and the face will become thinner from lateral surface to lateral surface. You can begin to assess what errors you may have made when getting the results, such as the picture on the far right. Can you figure out what may have happened when this instrument was sharpened? More than likely in this example, too much of the stone was being applied to the lateral surface at one time, leading to a pointed instrument. When should we discard an instrument? It's not always easy to determine when to discard an instrument. This has always been a difficult question to answer because we all love our thinner instruments. The technique TheCube recommends is the flex test. If the instrument flexes at all by pressing it against a hard surface, like the countertop, discard the instrument. If it flexes at all while sharpening it, discard it. You do not want the risk of the tip breaking off into the sulcus during use. If the tip breaks off, follow standard procedures. In review, let's look at the 5 most important items to remember. Know the original design of each instrument. Sharpen the instrument correctly to maintain the original design. Identify when to sharpen at the first sign of dullness. Know how to assess and correct an improperly sharpened instrument. Know when to discard an instrument. Remember, sharp instruments work better and prevent injuries to you. When sharpening, grasp the instrument with a firm hand. Keep your elbows against your sides to stabilize the instrument. Keep the terminal shank perpendicular to the floor. Keep the instrument face parallel to the floor. Always maintain the stone at 110 degrees. Start at the shank, adapting only 1 to 2 millimeters of the stone to the instrument. Only sharpen in 2 to 3 millimeter increments at a time. Sharpen each section until dust appears. Be sure to wait for the dust to appear. Sharpen the entire length of the lateral side in 2 to 3 millimeter increments. Do not turn the stone inward when reaching the toe. And finally, test for sharpness by shaving the test stick.